This video lecture has to do with principles of healthcare ethics. We looked at theory in a previous lecture as part of our ethics toolbox. In this section, we want to look at specific principles which may be of more help than theory for most cases. Now, principles, in any case, are rules or guidelines for behavior. Ethical principles are rules or guidelines for ethical behavior. And as I said, they're tools in our toolbox. Now, we can list these, 4 of them. These words may seem unfamiliar, but once you understand what they mean and maybe a little bit about the root word, it'll be more clear. There's non-maleficence, beneficence, autonomy, and justice. The latter 2 may be more familiar to you, at least the terms. Many of you may be familiar with the Hippocratic Oath, or certainly the first part of it. First, do no harm. Benefit only is the complete line, and so there are actually 2 principles embedded in there. First is the principle of non-maleficence, which is do no harm. The idea is that you don't deliberately harm anyone, and certainly this is part of all helping professions. Your job is to help people, so if you were deliberately harming them, you'd be violating the very essence of what it is you're supposed to be doing. But there's other ways you can harm people that aren't direct. You could be negligent. You could omit to do something that you're supposed to do and not do something that could harm them in some way. And you could also violate their autonomy, that is, their freedom, their ability to make their own choices. You may think you're helping them and not harming them, but you're actually taking the decision out of their hands, and in that way you're violating their sense of self and their ability to be self-directed. The second part of the Hippocratic statement we saw earlier is known as the principle of beneficence. It's that you benefit only, that all of your actions taken towards a customer or client or even others in your workspace and around you, you would try to only take actions that benefit them. You can take neutral actions, actions that have no effect one way or the other. If you take an action, you take one that does not harm them and that benefits them. The next one is the principle of autonomy. Autonomy is from words that mean self-rule. The idea is that we think of people as being in charge of themselves and that they should be able to determine how best to live their own lives. That's why we have patients have to consent to treatment as long as they're capable of doing so. So one way we can express the principle of autonomy is that we respect the self of another. We respect their freedom. We respect their personhood, is sometimes said. Issues that come up are competence. Is the person competent to make their own decisions? Sometimes they're not. Sometimes they may be children, or they may be elderly people who are so infirm that they cannot make their own decisions, or someone could have the inability to even speak because of a medical condition and not be competent to make their own decisions, in which case it's the autonomy of whoever the person is who's capable of making those decisions who is needs to be respected. And then there's the question of coercion. Is this person being forced to do something by someone else? You may think, well, they're freely acting, but someone is pressuring them, whether it's children or a spouse or a parent, and a caregiver and a healthcare provider needs to be conscious of this kind of thing that could be happening and disrupting someone's autonomy. Then there's the concept of justice, and our text spends a lot of time talking about 2 kinds of justice. In its basic sense, is that we treat everyone fairly. So anyone similarly situated, we would treat them exactly the same way. But there's 2 sorts of justice that are discussed, and one is procedural justice. This is the idea that's exemplified in the law under the idea of due process, that we follow the rules. No one is treated differently according to the rules, equal treatment under the law. And in an ethical sense is that we make sure that we follow each step in the way we treat someone, so that each step of the way they're being treated fairly. Now, a little bit more complicated, and I just have you skim the section on this in the text, is the idea of distributive justice. And this is the idea that in society, in any community, there are benefits and burdens. They say there are good things and bad things. Some things we have to do and take on, and some things that we get. And so the idea is, well, what is your concept of who gets what and why do they get it? So it becomes a very complicated philosophical discussion about what exactly everyone deserves. And depending on your political views and other ethical views, you may have a very different concept from some people about what counts as distributive justice. Certainly a hardcore capitalist would have a very different idea from a hardcore communist about what distributive justice comes to. So in summary, each one of these principles we could just express without the fancy words and say, well, these are ones that should guide our actions as workers in the healthcare field or other service fields or any field at all, and perhaps in every aspect of our lives, that we would endeavor not to harm people with our actions. We would try to benefit them if we do act on their behalf. We'd respect their autonomy, their freedom to make their own decisions, and we should treat everyone fairly. That is, we should be just. Now, finally, the text talks about the idea of reflective equilibrium, and there's a nice figure on page 53. Without rehearsing what she said, you can just look and see that the arrows are going both ways on the figure. And the idea is that you have an issue, and that either in your own mind when you're thinking about things or in discussion with other people, you go back and forth between various things, principles, the common morality, which is sort of our everyday thinking about these things, the conclusions we've arrived at, etc., and to come eventually to a decision that's sort of a balance of a lot of different things. So here we have our principles for our ethical toolbox. We'll be using them in the weeks ahead at various points, and to try to examine issues and to discuss them amongst ourselves. Right. End of lecture. Cheers.